Once again, today is our 1208th day of continuous webinar. Today's our guest is Dr. VIBHA MEVADA Sharma. She has already taken classes in IFPH and she was trained under Dr. Rajan Shankaran and Dr. Dinesh Chauhan. And she had done master courses in homeopathy like CCAH and MCAH, YPI. And she's the author and speaker of different national and international platforms. She is a yoga protocol instructor and chief editor of Homeopathic Healers and ex-coordinator of Scientific Committee Board of All India Homeopathic Association. And she got many awards. First runner-up award in India Homeopathic Case Presentation competition, and received appreciation letter from the State Council of Homeopathy. And today's our subject is thyroid diseases. Dr. VIBHA, you are welcome to International Forum for Promoting Homeopathy. Thank you. Your screen is visible.
Okay. Okay, so thank you so much, doctor.
Your sound is feeble. Can you?
Is it okay now? Better?
Now also it's slow. I think no need to connect the
Bluetooth
earphones. Now
how is it now?
Yeah. Now it's
okay. Okay, so thank you so much, doctor, for your kind words. And as you all know, today's topic is homeopathy, a future for thyroid treatment. So everyone, without wasting time, I just like to start our session with the remembering and to our master, Dr. Samuel Hahnemann, sir. I'm going to dedicate this session to him only. So everyone, before going to start any case or homeopathic perspective for the thyroid, in my understanding, we should go through some basic things first to clear the understanding for the topic. So first of all, if you know the anatomy of any topic is must to read out. Yeah, so this is the very basic picture which is there on your screen, where we can understand the situation of the thyroid gland, which is a butterfly shaped gland, which is situated in the in your throat especially, and it have two lobes, the two lobes which you can see in your screen clearly, right? Another thing, when we are talking about the thyroid disease, and why I put the title of today is the future of homeopathic, the future of thyroid treatment is homeopathy only. During this whole session, you can understand why the title is selected like this only. So you can say in all types of endocrinal disorders, the most commonly found one is the thyroid disease, right? And only on thyroid disorders, the 50 billion US dollars worldwide is extended annually for the healthcare of this particular disease only. And if we talk about the percentage wise, how much people are commonly getting affected by this, so by the age of 50 10% women have abnormal TSH, that is thyroid stimulating hormone. And if we talk about up to the age of 60, the 17% women and the 9% males are getting affected with this problem. So if we see the percentage-wise ratio of both the genders, which are commonly affected by the thyroid disorder, so we can understand that 25% of male and more than 45% of female are getting affected by the thyroid up to the age of certain certain age period. When we talk about the up to the age of 50 or up to the age of 60, that is the research based data. But nowadays what in I think last some decades, When we are handling in our clinical practice of all the thyroid disorders, I don't believe that the 50 up to the age of 50 or 60 people are getting thyroid. Even up to the age of 19, 18, with the early teenage age, even they are getting the thyroid disorders, especially in the teenage girls, right? Okay, so as we say the thyroid disorder, so commonly when we talk about the thyroid disorder, the majorly the two categories have come up to understand the thyroid disorder. That is the hypothyroidism and the hyperthyroidism, where we can understand both the thing by the hormonal levels, by the level of T3, T4, and TSH respectively. Others are there, but majorly these two things are there in endocrinal or thyroid disorder. When we say, if you leave the thyroid disorder untreated or partially treated, or with only treating with the modern medicine, what are the complications the person should get in the further life or in the future? Is the chances to get infertility, the muscular weakness, osteoporosis, dyslipidemia, some heart diseases kind of things. So these are the disorders what a person, those who have thyroid already, can get in their future life, right? So let's see what the word meaning and what history says about the thyroid, right? So if we talk about the word meaning, so this word is very ancient and anciently come from the Greek, where the word is thyroidoides, which meaning the oblong door-shaped shield, which is the shape of thyroid gland, right? And it's a long history, is inseparable from that of the goiter. So this word goiter, which is come from the Latin word gutter, which means throat, yes, and which is recognized in 2700 BC, long ago. Not only on that era, but if you talk about the Hindu holy texts, they mentioned about the Adam's apple in 300 BC, right? And they use the first word, the first term, that is thyroiditis, which is again for the shield-shaped cartilage, in order to describe the Adam's apple in the throat. So again, if we talk about the history, in 1956, Thomas Watson gave the term thyroid gland first time, right? Because of the shield-shaped cartilage, right? And in 1776, Heller classified thyroid as a ductless gland, means there is no ducts in the gland. Okay, come out from the history now. Let's see embryological development. Why the thyroid topic is important to understand, because thyroid is the first organ to become distinct in human embryo. By the age of 3 to 4 weeks, means almost 1 month of gestational period, the appearance, if you go through this image here, you can see here the 4th week image of an embryo, the early 5th week image, the late 5th week image, and the 7th week image here, right? And you can understand there that up to the age of 4 weeks, the thyroid gland is started developing, and up to the age of 8 weeks, the thyroid gland is started working in for the embryo for the further growth and development of embryonal body. Right, and up to the 10th week, the gestation means it's contribute for the development of physical and neurological features to the embryo. That's why from the development perspective, from embryonic life to our whole life, the contribution of thyroid gland is very high and very, very, very important. It plays a very vital role for the development from the embryonic life to whole of our life. That's why the maintenance, that's why the caring of this particular gland and the person, those who are suffering from thyroid, is very important. So when we see how important this gland and how important its contribution to a human life is, we should understand the evolutionary biology also. So in the lowest vertebrates and in the homologous tissues of the higher invertebrates, the fraction of the thyroids are intimately connected with the ducts of the sexual organs also. That's why it plays a great link between sex and brain also. Right? Another major part. Now, how the synthesis of this major hormones happens and from where it happens. So when we are talking about the TSH, the thyroid stimulating hormone, it's synthesis by the pituitary gland, the master gland of our body, and that's to the anterior part of pituitary gland. And in turn, pituitary gland is stimulated by TRH, which is secreted by the hypothalamus. You can understand here in this diagram. Right? So, thyroid gland secretion is regulated by a negative feedback mechanism, which is between the pituitary gland and hypothalamus. So as we see, pituitary gland secretes TSH, thyroid gland secretes T3 and T4, and hypothalamus secretes TRH in the negative feedback mechanism through pituitary gland. And what this TRH does, what is this TRH doing? When there is increase of T3 or T4 in the blood, this TRH inhibits hypothalamus. And when there is decrease of T3 and T4 in the blood, it stimulates hypothalamus to make the balance in between hormones. Right? So this is the regulation and function of all these hormones. So let's understand what is the basic function of thyroid. As we see about the gestational period of an embryo, where what the role of thyroid gland represents. So you can understand here the basic function is to growth and development. Right? And if you talk about the thyroid gland, it is heavier in female than in male. And during certain periods, like during sexual excitement, during menstruation, and during pregnancy, it becomes enlarged. Another, if we talk about another basic functioning, so it's an energy gland, you can say. Because the secretion which is synthesis by this gland are control the speed of living. Because if there is no secretion of thyroid or low secretion of thyroid, the output of large and rapid fluctuation of energy mobilization for any sudden muscular ache would be quite impossible. And if we talk about the symptoms, how clinically you can diagnose either the patient is belonging from the hypothyroidism or from the hyperthyroidism. So with the symptoms, we can understand that because in hypo and hyperthyroidism, exactly opposite symptoms are the representation. In hypothyroidism, the representation shows the weight gain, constipation, cold intolerance, depression, fatigue, heavy menstruation, muscle ache, dry hair, puffy face is there. And exactly opposite, if we saw in the hyperthyroidism, there is weight loss is there, infertility is there, irritability is there, nervousness is there, scanty menstruation is there, sweating is there, right? So clinically, we can diagnose like this with on the basis of symptoms only. So as we know, the pituitary gland, the master gland, this is the gland of intellectuality. Right? What it means the capacity of the mind to control its environment by means of concepts and extract ideas. On another hand, the secretion of thyroid gland is also necessary for the proper mental activity and for the reproduction of species. Because if it's not there, on every plan, like on mental plan, physical plan, on every plan, you can find out or you can get the symptoms out of the deficiency or out of the hypersecretion of thyroid. There is complexity of the thoughts. There is no learning, no education, no habit formation. No physical function. And why almost all the major systems are getting affected? If you remember the embryological part, what I explained already here, in the first 4 weeks, thyroid gland develop and start further working for the embryo, for the development of embryo. And if it's not there, everything will be get affected. Okay, so we can say that thyroid controls the mental development and is the great link between the brain and the organ of generation. So you can say only 3.5 grains of thyroid secretion, which is the daily secretion of this hormone, is this stands between the intelligence and idiocy. If it's there properly, intelligence is there. If it's deficient, idiocy is there. Psychologically also, there is a huge impact because of the thyroid secretions. So many these researchers did huge research on this, and one or more thyroid abnormalities in actually hospitalized psychiatric patients range from 6 to 49%, which is huge in my understanding. And commonly, what abnormality the people got is euthyroid 6 syndrome. And why euthyroid 6 syndrome develop? Because of both depression and schizophrenia. So what is euthyroid 6 syndrome? It's an abnormal finding in thyroid functioning tests occur in the setting of non-thyroid illness. It means person is not suffering from thyroid actually, but they are suffering with some mental disorders like schizophrenia or depression, and out of that their thyroid test like TSH and this thyroid hormones are unstable. So if we see the psychoneuroendocrinology, so in the first half of 20th century, some researches shows that the link between hormones and the brain function. And it's proved by Harris in 1940s with the evidence that factors released into portal blood from the hypothalamus exerted control over pituitary secretion. Right? And in later on studies also the same things are continuously proven. So we can understand that PNE deals with interrelated disciplines of psychiatry, neurobiology, endocrinology, immunology, neurology, and psychiatry. Means all the important systems are covered here. Right? So when researchers prove this thing, what we are doing in homeopathy, what our master said in homeopathy already, it refutes the mind-body dichotomy as it is never a mind or body. We consider mind and body as a whole, as a one person to treat, and not mind and body as a separate identity to treat, which is the fundamentals of homeopathy and given in our organon of medicine. And to understood this point, I just request every one of you to read aphorism number 210 and aphorism number 5 from Organon of Medicine, 5th and 6th edition. Further, let's start with a case for the better understanding of homeopathic perspective of hypothyroidism and how we can deal with this kind of endocrinal disorders. So this is a case of hypothyroidism in a female of 43 years of age. She is a professor by profession. So this patient consulted to me on 6th of December in 2019. And she said she was suffering with the hypothyroidism since August 2018. As she is the known case of hypothyroidism, she come to me with the report, with the lab investigation, where I got the TSH is 9.24, which is very high, and T3 and T4 is in normal range there. So as I proceed with the case, patient started explaining about herself. She said that I achieved everything in my life. I did whatever I want to do. I choose my career by my own. I did love marriage. I have one child, which is my decision. Till now, I worked with 3 organizations only. I doesn't change my job so frequently. But the thing which is bothering her in her life is that his husband used to change jobs very frequently. And which is the stressful thing for her. She's like, he fulfill all his responsibilities, but I doesn't like that he switches jobs so frequently. She's like, if someone asks me what my husband is doing, it makes me feel so angry that he is the one who put me in this situation, because he so frequently he is fluctuating with job, and currently when she come to me, he was not doing any job. So according to her, job is important for the social status. And she's like, if I know, although she did love marriage, she's like, if I know about this habit of him that he is going to switch jobs so frequently, I will never going to marry him. She feels like she should do some struggle and she feels helpless there. She's like, the wow feeling in the job is very important for me. It's very important to feel that wow feeling in the work. And according to her, whatever we are doing, our position should be very good. It gives grace and financial stability. And a person should be career oriented. She's like, I'm very obstinate by my nature and still I'm the same. I'm the very pampered child in my family. If I want something as in my childhood, I know how to get it from parents. And she convinced them according to her. And still she is like this only. She's like, I'm very workaholic, very enthusiastic person, very hardworking, very rigid in their nature, very career-oriented woman. She's like, I started working with the head post because the wow feeling is important for her. She's like, I love if the work is going very systematically. And for doing things very systematically, she is stressed out a lot. She's like, I'm doing MBA right now, right? Out of hobby. And that's too like a student. I'm just reading whole syllabus, attending classes, and doing all the file works and everything. Because she wants things systematically. She's like, I have a aura around me. It's like, it's not possible for everyone to come close to me and talk very easily. She's like, very few best friends I have, just 2 or 3. She's like, if my boss is talking to me, they also can't talk to me so casually. Other than that, she is like, I'm a very religious person, have a strong trust on God. Without worship, I feel incomplete. And when we check her childhood, she explained about her childhood that my father used to dominate my mother. And I feel that my mother should take a stand for herself. And because my mother shouldn't did that, I am become rigid. Because my mother was very flexible. And she got agree with everything of my father. And further she said, as she already explained, that she's a very pampered child. She's like, I got a lot of importance in my childhood, as I was the only child at home for 8 long years. Like now, in the childhood, in the school also, the classmates are hesitating to talk to her. If we talk about the OBGYN history, she started menstruating at the age of 14, which was very regular. She have one daughter right now. And she had her menopause also. And some menopausal symptoms also. If we talk about the family history, not much is there to have in family history. Instead, her sister have hypothyroidism. Both the parents are diabetic. And 3 paternal aunts are there, those who are hypertensive. If you understood generalities of this patient, she is like a desire for milk, curd, potato, and have a strong aversion from onion and garlic. She doesn't like the smell of garlic. As well, banana also. She didn't like banana also. Thermally, she is hot. She get most of the time perspiration on the face. So, this is about the case. And this is the before and after report of the patient, where you can see the report of a 2nd December 2019. Here it shows the TSH is 9.24, and in the after report of 28th of January 2020, the thyroid is the TSH is 4.33, which is absolutely normal, right? And if you want to check the testimonial video of this patient, you can go through our YouTube channel by Dr. VIBHA's Homeopathy, and this is the link of YouTube. So let's see how I solved this case. If we see the analysis on mental level for this particular case, what we got very, very important in the case is she is religious, she is thinking so positively, she is passionate for the work, irritable if things are not going according to her. As well, she can convince people according to her, very enthusiastic, as well decisive. She can take her all the decisions she took in her life. Right? So, on the basis of this analysis, these are the rubrics what I choose for this case. First is the obstinate headstrong. As she explained already that she is very obstinate, जिद्दी थी बहुत. The positiveness, the passionate, the pertinacity, firmness, irritability, contradiction from. If things are not going according to her, she get irritable. Religious affection, seriousness, she's so serious about her work. The disease itself, thyroid gland. The miliary theme duty I took because what she explained everything about her work, which can represent how the work and work on time, work with punctuality, work with regularity is important for her. And climacteric period aggravation because, as I already said, that she had menopause and she have that time she had some menopausal postmenopausal symptoms also. So when we put all these rubrics in our repertory chart, what we got here is so many medicines are there, those who are covering almost all the symptoms here in the repertory chart. Where in first number Naxomica is there, another is sulfur there, then the Ferrum Met is there. Out of all these medicines, my prescription was Ferrum Met. Because, as we all know very well, repertory is just the tool to get idea for medicines. And the final authority is Materia Medica always. So although Ferrum Met is there on the third position here in repertory chart, on the basis of Materia Medica and the understanding of whole case, I prescribed Ferrum Metallicum 200 single dose with SL for the 4 weeks to this patient. After 4 weeks in the follow-up, what I got is, she's like, overall, I'm feeling good. Mood swing is much better now. Anger is better now. And she's like, my workload is very high right now, but still I'm not feeling that much tired like before. She's like, I doesn't used to cry on small things now. And overall, she is feeling better. So with this positive prognosis of the case, I put on the to this case to the SLs only, doesn't repeat it medicine again for the next 4 weeks. And in the next follow-up, what we got is mood swings better by 75%, irritation reduced by 75%. She's like, I can tolerate the things better now. Means I'm not getting affected by things so easily now. Right? And the TSS report, what I showed you before, on January she did already the TSS report, and which came normal. And because the report already came normal, she is improving a lot. Still, I didn't repeat any dose and put the patient on SL for the next 4 weeks again. And in the next or fourth follow-up, she said that my mood swing is better and irritation is better by 90%. Overall, she is feeling better. But a new symptom appeared there, which is during menses, there is some pimples on labia majora is there. Was there before her menopause. And she's like, now that symptom is reappeared to me. First time after that. And reappearing of old symptom is always a positive sign for the progression of case. So here, because symptom is reappeared, and that pimple is so much painful for her, she want to get out from this pain so frequently. I repeat the same medicine with the same potency, Pyrametallicum 200 single dose again, and put her on SL for the next 4 weeks. And in the next follow-up, everything will be better. There is no symptom, even that labia majora pimple was not there now. So again, put it her on SL and and after that, we stop her medicines. So this is how we got result with this case. Now, if we talk something more about the thyroid disease, so how we can get diagnostic estimation of thyroid disorder? First one is the thyroid profile by the blood sample. Another is the TRAB, that is TSS receptor antibodies, measurement of thyroglobulin, ultrasonography, if there is swelling in the throat or goiter kind of symptoms are there. We can go through the ultrasound or thyroid scan. And either with RAIU, radioactive iodine uptake. Right? Another thing, we should know the normal values of all these hormones. Right? We should know that what happens in hypothyroidism, what happens with hyperthyroidism. Because when a patient comes to you with a report, most of the time your patient doesn't know the difference between hypo and hyper. They commonly know that two kinds of thyroid, in one weight is gaining, in another the weight is losing. But we should know that in hypothyroidism, there is higher level of TSH as well as the lower level of T3 and T4 should be there. So when we categorize hypothyroidism in primary, secondary, and tertiary, so in primary, there is reduction of T3, T4 and increase of TSH is there. In secondary, it reduced T3, T4 and higher the level of TSH with higher the level of TRH. And in tertiary, it reduced T3, T4 and TSH with low of TRH. If we talk about how you can use repertory for thyroid cases, and where you have to look to take that pathological symptom or to take the disease itself in your repertory chart. So in complete repertory, you can go through the neck and clinic chapter. In CANT repertory, external neck. In the chapter of external neck, you will get the rubrics. In FATAC repertory, as it's an alphabetical repertory, you can get the thyroid or goiter thing in G and T alphabets. In Boger synaptic key, neck, external throat. In Nayer's repertory, neck and back goiter, or in neck. You can get the rubrics related to thyroid. Sometimes the single drug rubrics are very helpful to prescribe, especially where we have to do the pathological prescription. And when we have to do the pathological prescription is where you're not getting something concrete to prescribe in your case taking. Then you can make ground of, for the prescription of pathologically. That time their use of single drug rubrics is very high. Because on local level, you can understand the thyroid is hard, edematous, dwarfishness is there, premature old is there, the grief is there, pain is there, goiter before menses is there, and the single medicines are there, which will work beautifully if exactly match indication. Yeah, like Netamur is there for the aggravation in the change weather in goiter cases. Thyroidinum is there for the allergic tendency. Salt craving, again Netamur. Desire sweet in goiter, thyroidinum again. Right? Like this, so many single drug rubrics are there. And I feel almost all the rubrics I covered to present here. Like with other systemic diseases also, you can understand the prescription. Like goiter affections with cardiac enlargement or a only medicine is there. Goiter affection with nervous trembling with thyroidinum. Goiter pulse changes. 3 medicines are there. Pulse fast, Ursio. Pulse slow, Cactus. Pulse increased, Jaborandi. Right? Although, with your homeopathic prescription, in some endocrinal diseases and in lifestyle diseases especially, you have to take care of dietary restrictions also. Like you can't say that in the case of diabetes, you just take homeopathy and eat whatever you want and homeopathy will take care of everything. You can't say that. Likewise, in homeopathy, you have to take care of some dietary restrictions like cabbage, soya, cauliflowers, sweet potatoes. And why we need to take care of these things? Because of the presence of iron and potassium in these substances, which can block the things, which can trigger the pituitary to release more TSH there. Right? Which is causing increase in thyroid tissue and promoting the formation of goiters. So, what our ultimate goal is to understand how a variety of psychobiological factors interact in the expression of the stress response as it relates to the development and maintenance of neuropsychiatric illnesses, and how a holistic understanding of a person is the need of the time. That is a need of homeopathy is here. So with this, I'm just like to end up my today's presentation here. I'm thanking to every one of you for inviting me and for the patients listening. Before going for the question and answer session, I just like to inform you all that we are going to start our courses, new batches of the courses from 1st of January. So this is the whole information. If you are interested, you can contact us directly. It's an online course of a 4-month and a 1 month of duration, where all the UGs, PGs, and practitioners are invited. This is the course where we are going to teach our students from very basics to the very advanced of homeopathy. You can understand all the basic fundamentals, the meisms, the group studies of materia medica, use of repertory, how to convert patient language into into repertory, and how to apply the organon, the aphorisms in the treatment of patient. So thank you so much, everyone, for your patience listening. Doctor?
Thank you. Thank you, Dr. Vibha. The way you are taking the class is excellent because we don't feel like a class. You are you are so cool and presenting the cases, and your description is like storytelling. We all are patiently listening. You are so cool. The way you are taking is very excellent. I like it. Actually, when I was trying to take the classes in slow manner, I couldn't. I'm so fast. So while listening your classes, I am thinking of how cool she is. Thank you so much. And anyone have questions, please ask. I think Dr. Vibha, you can share your number in the chat box also, because while you are showing your screen, if anyone took the photos means they can, otherwise it won't. Dr. Danesh has raised hand. Dr. Danesh, please ask.
Good evening, Dr. Vibha. It's really a very good session from you. As rightly pointed by Dr. Ajani, Dr. Kool has presented everything in a beautiful way.
Yeah, she's as cool as cucumber.
Yes, all things begins from the, you have covered from A to Z of these thyroid disorders. And as we know that the thyroid disorders is one of the biggest area for us to move forward with homeopathy, because a lot of, I must say, at least one case in 10 patients is a regular method that we are getting in every clinic nowadays in chronic diseases. Particularly, people are more affected with the thyroid disorders, but most people believe that it is due to the iodine deficiency, but it is not. So, but frankly, the people are undergoing a lot of stresses nowadays with what they have before. But in the early days, people used to live together and family is a big one. But nowadays, the nuclear family has started and people are staying in different part of the world, and as well as different part of the homes also. Most of the people are sitting in front of the mobile, and even they don't have to chat with others. They have no time to chat with others also. And people are totally different. There is a sleep, their sleep conditions are entirely different nowadays. So people are sitting very late and waking. They also wake up very late in the morning also. So these are some of the things that makes things more easy for us to trace the case. And when, as a homeopath, as you rightly pointed out, the mind of the patient is more important than the disease itself. It will be the disease, whether it is hypothyroidism or it is hyperthyroidism. It doesn't matter much. What matters in, as far as homeopathic doctor is concerned, is the mental symptoms of the patient, the cause and effect areas. You know, the cause of, if you are able to find out the cause of the disease or cause of the illness, you will be able to move forward in the shortest possible time to win and conquer the patient with our homeopathy. The most important point is that when you undertook the homeopathic treatment for thyroid disorders, you can definitely stop it once the patient becomes normal. But the other system, it is not so. They usually give the patient the medicine, and then they begin with 2.12.5, then 25, then 50, then 75, 100 milligram, then 150, then 175 and 200 like so. And that last they will remove the thyroid, and they say that oh, your thyroid is not working, so there is no need for this, and so we have to remove this, and then they were forced to eat once again the same way they took medicine. So all this may end up in thyroid. The other complication, particularly cancerous condition, may develop in the later part of their life. Anyway, it's really a wonderful session, and hope that all of us can go through your presentation again and again through the video, which will be uploaded tomorrow itself. So those who miss the case here can also watch the presentation tomorrow itself. Anyway,
Yeah, so one more thing I want to add here, sir. As you said, the potency of medicine is always increased in the thyroid medicine. So I must say to homeopaths, because when patient come to us already, most of the time they already on thyroid medicines, the regular basis hormonal supplements already. So this, fortunately, this case come to me very earlier, and she doesn't started any allopathic medicine or daily basis hormonal pills for daily basis. So if patient come to you with the chronic, intake of some kind of hormonal medicines like thyroidinum or something like that, so immediately do not touch to the potency or the medicines, whatever is going on, until whatever potency or power the patient is feeling better or not feeling better. Do not touch that. Just start our homeopathic medicines. With the time, when you see the report is coming normal, gradually we need to temper the dose of medicine, whatever is going on. Like if a patient is on 100 mg of medicine, you need to temper it, like 12.5 you have to temper. Then again, when the patient condition is normal, we need to very slowly we need to temper. And why I'm adding it here, because uh, 2 years back, a junior of mine sent a thyroid case to me, which is a case of a 19-year-old girl. When the patient consult to her, she immediately stopped that hormonal pills of her, right, on daily basis wala medicine. She immediately stopped, and her thyroid and all the symptoms are come up like anything to her. And then she referred that case to me. So the only mistake was there, that she started homeopathic medicine, but she stopped allopathic medicine immediately, which is not true with any medication. Do not stop any regular medication of any patient, right?
Yes,
So
exactly. This is the way one has to do. But just wait and see what happens once you begin with your homeopathic medicine. Then you can gradually. What I usually do, when if a patient is taking 100 milligram of medicine, allopathic then I just ask them to take you 50 milligram, and then you go with the homeopathic medicine, and within short time we will be able to reduce it to 25, and then gradually we can go for to 12.5, and then we can withdraw the medicine, and we can continue with the medicine. But the most important point, as you rightly pointed out, is that if a patient come up with the first consultation directly to homeopathy, definitely we can conquer the case within a short time. That I have seen in many times. But if the patient is under allopathic medication, things are entirely different. It will take a long time to conquer the patient. And this is what my opinion too. And thank you, Dr. VIBHA, for your excellent presentation at this evening.
thank you so much, sir. And thank you to IFPH for giving me again opportunity to present my views on the thyroid disorder. Thank you so much.
Thank you so much. IFPH needed you more. We need more knowledge from you, Dr. Vibha. And again, you have to come to our forum and share your knowledge.
That
And
will be my pleasure to have here. Thank you so
thank
much.
you so much
Thank
for
you.
coming, and thank you on behalf of IFPH. And now we are moving to our Malayalam session. And thank you. Good night, everyone. Bye. See you at the same time tomorrow. And I'm inviting Dr. P. Shaila for moderating Malayalam session. Dr. P. Shaila.